Welcome to a new eye-opening video of AKTK Geo. America is famously known as the land of the free and the home of the brave. Irony died 1,000 deaths on hearing this term, because the land of the free and the home of the brave was coined by Francis Scott Key, who himself was a slave owner. So much for being the land of the free. Anyways, that is a topic for another time. Speaking of deaths, what if I told you that America has become the land of the dying? Sounds unbelievable? Hopefully, by the end of this video, you will become, as Imagine Dragons say, a believer. The term missing Americans was coined by Mr. Jacob Bohr, who is a Boston University professor of Global Health and Epidemiology. Jacob Bohr and his colleagues published a report, Missing Americans Early Death in the United States 1933 to 2021, where they compared US mortality rates with those of Canada, Japan and 16 other Western European countries. The term missing Americans means how many American lives would have been saved each year if US mortality rates have matched those of other wealthy nations. What is the answer? Get ready to be shocked.
Professor Jacob Bohr's research shows that the number of missing Americans in the year 2019 was astonishing. The number was more than 6 lakh. After COVID, in 2021, the number of missing Americans swelled to almost 11 lakhs. Sad part is, half of them were under the age of 65. One might not realize the seriousness of these numbers. So the researchers found a very ingenious way to do it. Researchers calculated if these missing Americans were born in Spain, Finland, Japan or other such country, then how many more years would they have lived? The answer is a staggering 25 million years just for the year 2021. America sustained 25 million years of life lost.
Well, Dying Young in the United States is a 29-page report which is co-authored by Professor Richard Rogers and published by the Population Reference Bureau. This research found that US youth between the age of 15 and 25 are twice as likely to die than the youth of developed countries like France and Germany. The following chart clearly shows that compared with the 16 other high-income peer countries, the United States has the highest age-specific mortality rates for every age group under age 25.
As you can clearly see, the probability of Americans dying at a young age is much higher as compared to other similar developed countries. The above statistics just skim the surface of the research. There were many more key findings and harsh truth exposed by Dying Young in the United States. What were the findings and how the research provides a comprehensive look at the death of young Americans? Let us have a look.
America is ranked number 1 in healthcare spending per capita. For a country ranked number 1, the report presents a very grim picture. We will look at some key findings of the report and also look at a few graphs which will show how highest per capita healthcare spend is not helping the young Americans to survive.
Between 2013 and 2019, all US age groups under age 25 experienced stagnant or increasing mortality rates, while other high-income countries saw steady declines. Compared with other high-income countries, the United States has the highest mortality rates for all age groups under age 25. Unintentional injuries, suicides and homicides are the leading cause of death among children and young adults.
More than 50,000 young adults would be still alive today had the United States achieved a modest annual reduction of 2% in the early life mortality among the age group of 20 to 24 between 2000 and 2017. Infants born to black women who have earned at least a bachelor's degree face a higher infant mortality rate than the infants born to white women without a bachelor's degree. Black and Mexican American children and young adults between the age of 1 to 24 face higher death rates if we compare it to their white peers. You know the reason why? There are several reasons like a lower level of family social economic status based on mothers' education levels, household income, and other such factors.
If we compare USA with other countries having lower incomes, still the infant mortality rates of USA is higher than most of the countries. Take a close look at the graph to understand exactly what I am saying. Only Mexico, Turkey and Chile have greater infant mortality rate than USA. Now that we have compared USA to other countries, we need to compare the different states of USA with each other. This comparison will definitely shed some light on the issue and moreover help us understand the cause of higher mortality rate. Why the place where you live in the United States affects your mortality rate. Let us investigate. American Inequality conducted research which found that the Americans born in certain areas of Mississippi and Florida may die 20 years younger than their peers born in parts of Colorado and California. If we look at the figures from 2019 to 2020, US life expectancy declined by almost 2 years. One might argue that it was the time of COVID pandemic, but if we compare the COVID figures with the other countries, America experienced a larger decline in life expectancy than any other wealthy country. What determines who lives and who dies in the USA and how it differs from state to state? Let us explore.
Well, three factors influence who lives and who dies, and they are wealth, demographies, and locations. State policies are directly proportional to life expectancy. The better the state policy, the better the life expectancy. Income support, Medicaid, expansion, stronger gun control, drug overdose prevention, and safe abortion access are among the drivers of regional divides in life expectancy.
States that have expanded Medicaid saved more than 200 lives per 1 lakh people and decreased the risk of premature death by roughly 50% for older adults who have gained coverage. The South, which has some of the most lenient gun control measures, lost 5.7 million years of life expectancy in the period of 2009 to 2018 from firearm related deaths only. On the other hand, northeastern states, which tend to have much stronger gun control measures, had 1/5 the loss in life expectancy. States that introduced policies to prevent drug overdose deaths, they've seen life expectancies increase by 11%.
Well, black Americans in every state have lower life expectancy when compared with their white peers, and there is a startling difference of 4 years.
If we compare incomes, the richer you are, the longer you live. If you compare wealthy regions like Colorado, Santa Clara, California, where median household income is more than $100,000, the life expectancy is 87 years. Whereas in the poor regions like Kentucky, Florida, where the median household income is around $35,000, the life expectancy is around 67 years. The stark difference of 20 years, and this graph will give a better picture.
All these figures throw up some very pertinent questions. Was the situation always like this in USA? If not, then what changed? Did someone predict the things to come? If yes, then why were the warnings ignored? In the next part, we will unpack all the answers.
According to Professor Bohr, the relative strength of organized labor and consequent rising wages, plus the large public investment that helped boost the middle class, like the GI Bill and the promotion of high home ownership, were the driving factors which helped Americans live longer. One thing to highlight here is that these advantages were available only to white Americans. Then came the reign of President Johnson, whose war on poverty, expansion of safety net by Medicare and Medicaid, as well as racial integration of hospitals in 1963, it bolstered the mortality rate.
Professor Bohr's research points the 1980s as the year when the shift happened and the mortality rates of USA started diverging from the other countries. The shift became more in the 2000s when the opium-related deaths increased and the more lives were lost in the prevention causes like suicide, drug overdose, and alcoholism. In 2017, economist Peter Tamin described how America began to diverge into what are essentially two separate nations in the 1970s. One nation around which 20% of the total population gets college education, good jobs, and access to quality healthcare, while the other nation where 80% majority resides is stuck with low wages, insecure jobs, fewer education opportunities, and unaffordable healthcare. Peter Tamin also points out that the US economic structure looks more like of a developing nation than a wealthy superpower.
Stephen Wolfe, the director at Virginia Commonwealth University, so he published a paper 10 years back along with other researchers. The research was titled Shorter Livers, Poorer Health, and it clearly pointed it out that USA was lagging behind other countries in terms of health advances, and something should be done about it. 2 years after the paper was published, American life expectancy became lower than Cuba, Lebanon, and Czech. The report also found the same factors for higher mortality rates which Professor Bohr's report found. The factors are teen pregnancy, drug overdose, HIV, fatal car crashes, injuries, and violence. The result clearly documented wide racial ethnic disparities in infant mortality and mortality due to unintentional injuries and violence.
I would like you to take a look at the death rate data of the United States for past 12 years.
The death rate has been increasingly steady, and even before the pre-COVID era, the death rate of USA was increasing at more than 1% per year. Professor Wolfe's research had highlighted this problem a decade earlier, but very little to nothing was done by the US government. When Dr. Wolfe was asked how much of the report's recommendations were implemented, he said, to be very true, very little of that happened. There was some media coverage at the time, but NIH was not involved in trying to promote awareness about this report.
Mr. Wolfe had forewarned of the impending calamity, but nothing was done. Researchers done by separate committees in different parts of USA had reached the same conclusion. But is the situation dead and lost? Is it too late for America, or is there something which can be done?
Data from 1998 to 2015 shows that more than 4 in 10 US children were either poor or near poor. In comparison to other high-income countries, USA has the highest poverty rates for children overall and for children living with single mothers.
The result clearly documented wide racial ethnic disparities in infant mortality and mortality due to unintentional injuries and violence. Widespread racism has reduced the access to healthcare systems and they are unable to get quality care. Measures such as increasing diversity among healthcare providers, providing full funding for community health centers and workers, and on the other hand, facilitating stronger enforcement of civil rights. All these can increase equality in healthcare settings.
Male mortality among men, especially between the age of 15 and 24, is higher than women. Increasing healthcare services and access, providing counselors and social workers in schools, and increasing mental health awareness are some of the measures which the government could implement.
Compared with peer countries, USA spends the most on healthcare per capita, but has the most costly, inefficient, wasteful, and inequitable healthcare system in the industrialized world. Worse health and comparatively low life expectancies. The COVID-19 pandemic has increased substance abuse among the youth and can cause immediate and long-term harm. Children have access to patchwork of healthcare and health insurance that varies by state. All states should adopt Medicaid expansion under the Affordable Care Act, which has improved infant and child health outcomes.
Motor vehicle crashes account for the most accidental death in early life. About 1 in 5 children passenger death involves a driver impaired by alcohol, and nearly 1/3 of children who die in motor vehicle crashes are not restrained. USA needs additional policies and programs to reduce injuries related deaths among infants, children, and young adults. A robust federal database of gun owners, national firearm licensing system, banning assault rifles, offering gun buybacks programs, and some solutions which the USA can implement here.
America needs to act, and act fast before things go out of hand. The answer is not very complicated. If other countries have found the answer to the question on how to live longer and healthier lives, then America too could do that. But the question is, does the US government feel that they are facing a problem? Truth, fact, reality, whatever you want to call it, US democracy is facing a health crisis, and many more young lives could have been saved through policies and interventions. The tragic part, all those lives lost were avoidable losses. Next time when you hear Land of the Free and Home of the Brave, feel free to add one more line, Land of the Dying.